outreach. All right. Hello, everyone. Thank you for all of you who are here in person, and thank you to all of our virtual attendees. If you are tuning in via Zoom, if you can just share in the chat to make sure that I can be heard, I would appreciate that confirmation. And anyone, you should be able to find your chat function at the bottom of your screen. And while we're doing that, I'll go ahead and say that this presentation is being recorded. So if anyone wants to share it, or if you want to access it later, or if anyone has to leave early or gets here late, you are able to access it on the allforknox.org website. And with that being said, let me go ahead and make sure that that is working. Wonderful. All right, so thank you again for joining today's speaker series, Understanding THC and CBD Regulations in Tennessee. Now, this session is part of the Substance Misuse Prevention and Education Speaker Series, which is a quarterly series focused on advancing and understanding the dialogue around substance misuse topics. My name is Sharana Cathy. I'll be serving as your host today, and this webinar is hosted by All for Knox, which is the Joint City and County Substance Misuse Response work group. Now, All for Knox, if you're not familiar with it, it does coordinate prevention, treatment, harm reduction, and recovery support providers across the county and across the city of Knoxville so that everyone is able to collaborate together more directly. If you would like to learn more about us, you're welcome to visit our website, which is, again, allforknox, as in the number 4.org. Before I introduce our speaker, I would like to review just a few housekeeping items. Like I said, today's presentation is being recorded, and following the presentation, all registered attendees are going to receive an email with information on where to find and access the recording, just as an easier way to get to it in case you forget the website address. Now, the presentation will last approximately 1 hour with time reserved at the end for questions, but Stephanie has already said if you have questions in the moment, you are welcome to bring them up. So in-person attendees, feel free to just wave your hand and make sure that Stephanie can see you. And then for those of you who are tuning in virtually, you're welcome to put your questions either in the chat function or the Q&A function, which you'll see at the bottom of your Zoom screen. And the ones that you ask in the moment, I'll make sure to just pause Stephanie where she is so that I can ask them in that particular time. Now, for this session, for those of you who are joining online, you'll see that all microphones and cameras have been disabled to minimize background noise and other distractions. So again, please make sure that you're utilizing your chat or your Q&A features at the bottom of your screen. I also want to note that today's presentation is for informational purposes only and should not be considered individual legal advice. At the conclusion of this presentation, everyone who's tuning in via Zoom and everyone who's attending here and our live audience will be able to share their feedback with us. We'll show those QR codes at the end. If you can give us your thoughts, we'd really appreciate it, as your feedback gives us insight for how to mold our future efforts and presentations. And that being said, we're very glad that you're here. Thank you so much for giving us your time. And with that, I'm going to go ahead and introduce our speaker for today. Joining us is Stephanie Strutner, who will be sharing her expertise and insights on both THC and CBD regulations here in Tennessee. A retired Substance Use Prevention Coalition director, Stephanie Strutner, MPH, owns and operates an independent consulting firm, Catalyst Evaluation Group, through which she provides support to clients through measuring impact and conducting biostatistical and epidemiological analyses. She also serves as a master trainer for CADCA, which is the Community Anti-Drug Coalitions of America, and serves as the part-time CEO for Prevention Alliance of Tennessee. Stephanie holds a Bachelor of Science degree in biology from Emory and Henry University, a Master of Public Health degree in Health Policy and Management from the University of Tennessee, mainly with a focus and field practice in epidemiology and biostatistics. She also has a certificate in social enterprise effectiveness from the College of Business Administration from here at the University of Tennessee, and is a Level 2 certified prevention specialist. Stephanie has spoken to the United States Congress on a number of occasions on the impact that drug use has on our communities before, and she has also testified before the Tennessee General Assembly on multiple pertinent prevention issues. In 2018, she was summoned to a meeting in the West Wing of the White House with the President of the United States to discuss effective opioid prevention strategies in local communities. In 2020, the efforts and impact of the coalition she led were actually selected for a showcase or for a case study that would be given to Congress. And since 2023, she has been invited by the Institute for Research and Evaluation to attend the United Nations Commission on Narcotics and Drugs, the Global Policy Forum for Drug Policy, where she has presented on best practices for impact evaluation. In her spare time, Stephanie is an avid snow skier and wake surfer. She also enjoys tending to her bees and plants, stand-up paddleboarding, golf, boating, sports, and spending time with her family. Please join me in welcoming Stephanie to the pulpit.
Thank you, Sharina, and thanks everybody for being here in person and on Zoom. First of all, I've got to shorten that bio because now that everyone's asleep, I'm going to have to put in a whole lot of energy to try to keep you awake for this presentation, because hopefully you love public policy as much as I do. Otherwise, you wouldn't be here. That's what we're going to be talking about today. And essentially, the pathway of regulation for both cannabidiol, oil, CBD, and tetrahydrocannabidiol, THC, or otherwise known as marijuana, and comes in many different forms, has been a long and winding road, both nationally and in the state of Tennessee. And so it's what we're going to talk about today. So I want to start with the background, and also want to reiterate that I love to have dialogue with you and not just speak at you from the slides. So please ask those questions online. Please type those questions in the chat. And Sharina, please interrupt me at any point where it's appropriate, because I want to make sure that we're talking about what you all want to hear about. But I think it's important to frame the scope of what we're talking about. And I don't want to take for granted that everybody understands what forms THC show up in our communities, and CBD as well. So I want to just give you a few names that you need to know. So the first is THC. THC, as I mentioned, is by definition what we have coined it in public policy, Delta-9 tetrahydrocannabinol. Delta-9 THC is what we call marijuana. So as many people know, there are hundreds of isomers of the cannabis sativa plant. Delta-9 is the THC we know as marijuana. It is what makes you feel high. So if you have any form of the cannabis sativa plant, sometimes it cannot have very much THC in it, so it would not produce as strong a high. The Delta-9 THC is what we consider being the marijuana that gets people high, or that euphoric feeling. I think it's also important to note when we're talking about THC that the potency of the amount of THC in marijuana, or Delta-9, has increased dramatically over the decades. And so oftentimes you'll hear people say, oh, marijuana isn't addictive, or you can't overdose from marijuana. That was true in the 70s into the 80s and even into the early 90s, when the concentration of THC in the marijuana plant was hovering around between 9 and 14%. That is no longer true. With the cross hybridization of plants, we see the levels of THC in the cannabis sativa plant being higher depending on the strain that is grown. And so with the ability as well to create some of these other products and really concentrate the amount of THC that is extracted from the plant. Maybe you've heard of dabbing or waxing. That's when someone uses chemicals to extract the amount of THC out of the cannabis plant. And then when you take, a plant that could be an ounce, and then you extract the oils out of it, then you're really reducing the volume. And so people use a larger volume that has a higher concentration of THC in it. And so that's how the levels are, in some instances right now, up to over 95% pure THC. And so now the old idea that you cannot become chemically dependent on or overdose from THC is no longer true because of the potency that it carries. When we think about the difference between THC and CBD, or marijuana and hemp, the definition legally, both at the federal level and at the state of Tennessee's level, is identified as 0.03%. So anything over 0.3% is THC. Anything under is going to be hemp related and is most commonly going to be known as CBD. So CBD is cannabidiol. It is also made from the cannabis sativa plant, but it's that percentage concentration that makes it different from marijuana. It is related, CBD is related to marijuana or THC. It's just a lower concentration, and so you don't get that euphoric high from the CBD. THCA is another isomer from the cannabis sativa plant. However, it's non-psychoactive, and it is found in raw cannabis. The difference here, and what makes this legal in many states under the Farm Bill, which we'll talk about, is THCA, when it is heated, becomes THC. And so it has to do with the carboxylation process. When it is heated, the carbon chain is modified that then makes it THC. And so in its raw form, it is legal, but then you heat it, which is how people use it, and then it becomes an illegal substance. THCP is short for tetrahydrocannabiferol. THCP is also naturally occurring from the cannabis sativa plant, but it is significantly more potent than THC due to its longer molecular side chain. So again, we're talking about those extra carbon atoms. They have a higher potential for binding to the CB1 receptors in the brain, which gives a much stronger euphoric effect. And so it can be up to 30 times more potent than even some of the higher potency THC that we have in the market today. HHC is another isomer that we want to be familiar with. That's hexahydrocannabinol. It's a semi-synthetic cannabinoid. It is also similar to THC, and it produces milder psychoactive effects. And so those are kind of the differences of the products. I've never been into a head shop. I've never been into a smoke shop. And so I don't even know what the landscape looks like in Knoxville. I give presentations all over the country. This is my favorite place to present because this is where I live. So I have the shortest commute that I have all year today. And I still don't know what the landscape looks like. Like, you walk in a store, what do you see? So we've got some people here who know. And so I want to give you just a snapshot of what we have here in Knoxville. So all of these products are from stores that exist here in Knoxville, and these are also advertised online. So openly advertised, and we see advertisements really being nondescript, false advertisement. We see a lot of products in Knoxville, in Tennessee, across the country that are advertised as Delta 9, when in reality, what's in the package is not, because then it would be an illegal product, but it's being sold on shelves. And so there's a discrepancy between what's legal and then what's marketed. And so that's something to be aware of as well. So THC products, this is what you might see when you walk into a shop in Knoxville to look for THC. So the first is marketed, the red package is marketed as THC, and it is marketed as Delta 9, but if it is truly Delta 9, it is then against the law to have in Tennessee. And so likely it's not Delta 9. And so we've got some false advertisement going on there. In the middle, you see the Jolly Rancher THCA flower. So this is clearly THCA, which is legal in Tennessee today. Let me make a disclaimer that tomorrow or at the end of the General Assembly, everything I say today might change, because there are several bills, which I will acknowledge before we conclude today, that are being considered right now that have to do with these products. In addition, the U.S. 2026 Farm Bill is looking at THCA, THCP, and HHC as well, to think about how those are going to be regulated federally. And so if you, especially for the people who are watching this as a recording, if you watch this after April 16th, 2026, all of this information might be obsolete. And so what you see in the middle here, THCA, which today is legal, but it's marketed as straight THC. And then on the right, this is marketed as straight Delta 9 from a store here in Knoxville. I'm willing to bet that it's not Delta 9, but that's how it's marketed. CBD, I think it has been legal in Tennessee for longer, so I think more people are probably familiar with the products. Often they do come as gummies. Up until just recently, there didn't have to be any dosing on the package. That has changed, and we'll talk about that. But so gummies, there's also CBD teas that you can find. There are a lot of CBD tincture oils that people use topically, and so that's mostly what you're going to see when it comes to CBD. These are some images of THCA that you could find in the Knoxville community. There are some pre-roll that would be smoked. There's the flower that is marketed, and then the THC disposable vapes. All of these products are going to come in variations that could be in a cart or a cartridge that could go into a vapor device and be vaped. These are some images of THCP. We also see a lot of CBD and all variations of THC coming into drinks. And so this is an example of a drink that's being marketed in Knoxville. There are also some THCP pre-rolls, as well as the live resin cartridges. So those resin cartridges is what I mentioned when people take the cannabis plant and they extract the oils out of it. That's how they're diluting it and making these resins. This is an example of that. The resin is going into a vape cartridge that people would then vape. Here's an example of some HHC marketed as highly concentrated, the live resin there on the left side of your slide. And then there are some flavored smokes in the middle. And then on the right, some gummies as well. Marketed as diet. So obviously there's nothing about being diet, but here we are again with some marketing. Jolene.
Do you think that the people who purchase these things are aware of the distinctions that you made among the different things? And would they be skeptical about whether something's really what it says it is?
So the question is, do people who buy these products know what they're ingesting? And I would say that some do. I would say some people are experts at what they are buying and ingesting. And then I would say there are other people who really have no clue what they're ingesting. And I think that's part of the problem. So some people are actively searching for what's going to give them the strongest feeling that they're going for. And then I think there are other people who are casual users who are just using it because somebody else has it, or they want to try it for the first time, or for whatever reason, and would be much less educated. And so you've got people who know exactly what they want. They know exactly the strength that they want because they're experienced users. They are not cannabis naive, and they know how to achieve what the feeling they want to achieve. And then the flip side of the coin is, I'm just going to recreationally use whatever I can get my hands on, and I've done no research. So I think you've got a combination of both. So now we have a snapshot of some of the products that people in town are using. And obviously there are enough people using, because I can drive down the street between here and my house in the eastern part of West Knoxville. And I mean, I'm going to pass countless shops that call themselves anything from a cannabis shop to a head shop to a vape shop and many things in between. And I'm going to pass many, more than I can count on two hands for sure. And so what do we do about this? And what's legal and what's not? And what are the ramifications for people mislabeling products? What are the ramifications of people actually having products in their store that are illegal? So we're going to talk about that. I mentioned the legalization road to marijuana, THC, CBD has been long and winding. And I don't expect you to necessarily be able to read all of these dates and points. So I'm going to go over each one, because I think they're important. And you can see how, as we travel through time, the changes become much more rapid as today. So when we start back in 1937, that's when Congress passed the Marijuana Tax Act, criminal marijuana. So that's when we first started to have laws around marijuana. Pop forward to 1970, now marijuana has become a Schedule I drug by the DEA, the Drug Enforcement Administration, when the Controlled Substances Act of 1970 was enacted. Pop all the way forward now to 1996. In 1996, medical marijuana was initiated in California. That is what really tipped the scales to start that movement across the country. Next came in 2012, in Colorado and in Washington, marijuana is legalized for recreational use. There are different ways that we call this. Some people call it retail sale. Some people call it recreational use. Either way, now in Washington and Colorado, the product is legal. What we see happening across the country at that point in time, prior to 2012, even after 1996, we didn't see a shift in adolescent perception of risk until 2012. Once 2012, marijuana was legalized for recreational use in Washington and Colorado, we see perception of risk among adolescents, 6th through 12th grades across the country, have a dramatic drop. So they think it's less harmful now because it's been legalized for recreational purposes. So we see that drop being much more significant with the recreational legalization rather than the medical legalization that happened in California years prior. So bump forward now 2 more years to 2014. Tennessee passed a bill allowing legal prescriptions for low THC products through CBD oil. So the cannabidiol oil, Tennessee has legalized for intractable seizures. So there was only one diagnosis that CBD was allowed for. I happened to be on the Hill during that time, during all of these hearings, and it was really incredible to see who showed up in support of the bill and who showed up in opposition of the bill. I'll say that everybody in the audience supporting the legalization of CBD for intractable seizures was not there supporting someone who had an intractable seizure. Fast forward to 2017. In 2017, Speaker Howell and Lieutenant Governor McNally order the formation of a joint ad hoc committee that becomes the Medical Cannabis Commission. So now we've got a committee in Nashville that's investigating, because between 2012, or I'm sorry, between 1996, when California first legalized, up to 2017, we've got states that are just legalizing for medical use, bang, 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 bang. So also want to make note that the FDA, the Food and Drug Administration, still today has not said that cannabis, that marijuana is approved for medical purposes. And so when we say, I'm going to use air quotes, which I know isn't necessarily popular, but I think it's really important to note that when we say medical marijuana, this is not a medical definition of marijuana. This is a state definition of marijuana, because the Food and Drug Administration that approves all prescription medications in our country has not approved marijuana as a prescription medication. So you technically cannot have a prescription for marijuana. You have a recommendation from some healthcare provider that then goes straight to a dispensary. So Tennessee has a medical cannabis commission that investigates what best practices are, what other states are doing, and that still exists today. It has been continued through bills in multiple years to extend that medical cannabis commission, which still extends through today. So 2018, the U.S. Farm Bill is amended. So it's amended historically. It's supposed to be amended every 2 years. In 2018, there was a change made to the United States Farm Bill that legalized multiple forms of hemp and differentiated hemp from other cannabis plants. So what happened in 2018 is our country legalized all forms of cannabis sativa under 0.03%. What this did was make Delta 8, which you've probably heard of, soar in sales. So now all of a sudden, we've got a loophole that has legalized a majority of the cannabis that is being sold today. Since 2018, prevention specialists have advocated very strongly to close that loophole. So strongly, in fact, that we are still operating under the 2018 U.S. Farm Bill, which I mentioned is supposed to be updated every 2 years. And there has been so much back and forth discussion and so much advocacy and so much controversy around this issue that in 2026, we are still trying to close that loophole. So in 2020, we now are facing the decision on the Farm Bill again. So Congress is having conversations. They're unable to come to terms with it. There was a period of time where the Senate allowed for open discussion, and residents could, I did provide input on what I thought should happen. Many prevention specialists did, and they ended up delaying that vote. Come to 2021, the medical cannabis bill failed in the state of Tennessee, but their qualifying conditions for CBD oil were expanded. And so remember, back in 2014, CBD was legalized for intractable seizures only in Tennessee. And so then in 2021, they then expanded the diagnoses that CBD could be allowed for in our state. At that time, they also initiated a 6% tax on CBD, they being the Tennessee General Assembly. So in 2023, we have a Senate bill that restricted the sale of HDC. So that's high density cannabinoids to minors under 21. So what this did was close that loophole. So the U.S. Farm Bill of 2018 just legalized, period. So that means a 11-year-old kid could walk into a store and purchase Delta 8. So in 2023, we had to work pretty aggressively, to be honest, to close that loophole, to make that you had to be at least 21 years of age in the state of Tennessee to purchase any cannabis product. Move forward in 2025, we've got a Senate bill that overhauls the high density cannabinoids regulations and moves oversight and enforcement from the Department of Agriculture to the Alcohol and Beverage Commission. This is a really important, very important turning point, because when the Tennessee Department of Agriculture goes in and provides compliance over products, for example, the Department of Agriculture is over nicotine tobacco compliance, or historically has been over tobacco compliance in the state of Tennessee. Because they don't have law enforcement oversight, it cannot be a criminal penalty for someone selling to someone underage. So this is important because it's a civil penalty. And so you get a $50 fine, a slap on the wrist, and you keep selling. Anecdotally, you cannot lose a license because there is no licensing structure for tobacco in the state of Tennessee. We tried really, really hard this year to get a tobacco retail tax. Unfortunately, the amazing Representative Reeves, who carried that bill for us, is also the representative who's carrying the, you've probably heard about the CVS PBM bill. And it was such a big controversial bill. He just couldn't do them both. And so the tobacco retail tax has gotten rolled, will eventually come up again next year, and we'll have to work on that very diligently because obviously the industry doesn't want that. They don't want a license. They don't want people to lose a license. And so that's the problem with the Department of Agriculture having oversight over any product, is that there are truly no legal teeth in anybody maintaining compliance, because there's really nothing that they can do about it. And so going to the Alcoholic Beverage Commission, TABC, now all of a sudden there is some oversight in cannabis products. So TABC now can create a list of these businesses that sell products. They can go in, they'll do their own compliance checks, which the Department of it's not that the Department of Agriculture did not do compliance checks. They did, but their regulations for compliance and ABC's regulations for compliance are very different. The Department of Agriculture's compliance checks are overseen by the SINAR Amendment. The SINAR Amendment is a federal amendment that says you have to maintain 80% compliance with underage tobacco laws, or you don't get your federal block grant dollars that go to your state. So states take that to heart really well, and they want to follow those rules. But it's different because they only have to run compliance checks once every 18 months, and it only has to be a spot check. So in Knoxville, for example, there are close to 1,000 businesses that sell tobacco-related products. The Department of Agriculture could come in and they could check 11 or 12, and that is their sample that counts for SINAR. With ABC actually goes to every business. So ABC obviously is over alcohol. Over the course of a stretch of time, they're going to visit every single retailer, whether it's on premise or off premise. And so that's the difference in compliance. That's why it's very important for us in our state to have the Tennessee Alcoholic Beverage Commission over compliance. And so now that brings us to current day. So now 2026, and I've got some bills listed here that I'll mention. They're in committee this week. So literally what we're talking about today could change by Friday, by tomorrow, just depending on, we're nearing the end of the session. They're looking at budget. So anything that has a fiscal note has been put behind the budget. If they're able to clear the budget up, pass the budget pretty quickly, then they'll get to those other bills. And so these regulations could change because there's some up for debate. So I want to give you a federal versus state context of the U.S. Farm Bill, because the U.S. Farm Bill really dictates exactly what happens with cannabis products in our states, because there's this thing called preemption. Preemption is that our laws cannot supersede, like our laws in Knox County cannot supersede the state laws, and the state laws cannot supersede the federal laws on paper. Because remember, federally, cannabis in any form is not legal. But we have states that have legalized both medical marijuana and recreational marijuana. And so they have, by definition, superseded federal law. And there's just, when I have talked to my U.S. representatives and senators, they're saying we just don't have enough resources to tackle this issue. And there's also not enough support in Congress to tackle the issue. And so we're in this place, this real icky place of limbo when it comes to regulation. I talked about the Extension Act. So the 2018 Farm Bill has been extended. So now we do have a new extension that was signed in November. And this extension in November closed that hemp loophole that had existed since 2018. These changes have not yet gone into effect, though. They don't go into effect until November 12th of 2026. So what's happening is we've given the industry, the cannabis industry, an incredible amount of time, 364 days to lobby Congress to change their mind. So even though we have this law that has passed that has said we're going to close those hemp loopholes and eliminate some of these products, we can't say we won that public health battle until November 12th of this year, because that's when we're really going to figure out if it worked or if it didn't. So the changes is the redefinition of hemp, and we're looking at total THC. So the 2018 definition only limited Delta 9 THC. The new 2026 federal law shifts to a total THC standard. So we're looking at the amount of THC in any product, whether it's THCA, THCP, HHC, no matter what it is, it's the total THC standard. So the percent of THC that's in that product that's going to be measured. The total THC limit must not exceed that federal and Tennessee state definition, 0.3% total THC. This is a dry weight basis, which explicitly includes THCA, the Delta 9 THC. So the impact here is that the federal changes mirror Tennessee's new stance already, and that would effectively end the legal sale of high-level THC products like THCA, including the hemp flower, that could previously be sold as non-intoxicating under the former Delta 9 Farm Bill rule. So that one carbon molecule. And so Delta 9 is traditionally what we call marijuana. Delta 8 lacks one carbon molecule. So the level of the level of THC is going to be a little bit lower. So it's going to have a less potent effect, but still has the ability to get the user that high euphoric feeling. No. So in the U.S. Farm Bill, they only defined Delta 9 as being illegal, even though Delta 8 is almost the same, just one carbon molecule different. So there's Delta 0. There's over 130 isomers that come out of the cannabis sativa plant. And so there's lots of different ways chemically that we can adapt those. I mean, I learned in college lab how to change carbon chains. I mean, it doesn't take a genius to figure that out. And so people can make those adaptations with these products, and that's the problem. And some of them also, you know, I talked about the THCP that, you know, on paper it's legal, but then if you heat it up, it turns into Delta 9. And so they're, you know, people figure things out and are able to circumvent the laws. This happened in Tennessee back in, I think it was 2006, when synthetic drugs were really becoming the thing that people were using. And the General Assembly was just chasing all of those substances. So the Tennessee General Assembly said, okay, this substance, like in the actual chemical molecule, is illegal in the state of Tennessee. But then they just changed it. People in a lab just changed it by 1 or 2 molecules, and now suddenly it's legal. So finally in 2006, we said, can we just say, or any substance that mimics the effects of? And so that's the real change in the Farm Bill of how Congress has changed it this time to circumvent all of these other isomers that are creating this loophole. So the grace period we mentioned, but the grace period is really important because it's going to make or break this law on whether it actually moves forward or not. So there's now the 0.4 milligram per container ceiling. So this kind of has happened with energy drinks along the way, where it was never really regulated how much caffeine or stimulant could be in one container. So for example, you know, somebody wants a little pick me up in the afternoon, they might drink a Diet Coke. People who are Diet Coke drinkers love Diet Coke. Why? Because out of soft drinks, it has the most caffeine in it, about 57 milligrams of caffeine per can, if you have a 12-ounce can. So now energy drinks emerge on the market, and energy drinks will say on the label how much stimulant per serving, but some of them have 4 servings. Do you remember? We don't see them as much anymore because there have been some regulations, but do you remember years ago, the Monster energy drink, the can was about this tall and about this big around, had 4 servings in it, 2,500 milligrams per serving of stimulant, caffeine, taurine, guarine combination of stimulant. And so in one container, it's 10,000 milligrams or 1 gram of stimulant, which is a considerable amount. So that's what we're talking about here, where if you hear people talk about if you're taking gummies, you take a little slice of a gummy. Well, I am aware that some people actually do slice and dose their gummies, but if you've got a first-time user or an adolescent, do you think they're going to microdose a gummy that's this big? No.
And I was going to say, I asked them that, like, if I asked them, you know, like, do you all pay attention to the nutrition packets? Like, would you all just pop a whole gummy in your mouth? And almost always, middle school and high school students would say, yeah, I wouldn't pay attention to it. I just do the whole thing.
So a comment from the audience said, asking middle school and high school students, do you look at the nutritional label or the label on any cannabis products, or do you microdose your gummies? And the answer was no, I just pop the whole thing in my mouth. And so that's exactly my point is, okay, the companies say, yeah, you just take a little slice and microdose, but nobody actually does that. So now we're looking at a finished product limit. So we've got the final hemp-derived product, so HDP, hemp-derived product, to remain federally legal. It cannot exceed more than 0.4 milligrams of total THC per container. So this is going to be for drinks. It's going to be for gummy packages. It's going to be for candy packages, edibles, etc. Vape carts. It's going to be 0.4 milligram ceiling. So this is a pretty low threshold. And so most current CBD gummies contain usually 1 to 2 milligrams of trace THC. And it would criminalize almost all hemp beverages at the federal level, potentially reclassifying the beverages that are made as Schedule I controlled substances.
Would that encourage people to create smaller packages? Like, here's a package of 1 gummy.
That is, I think, the point, because I think that we're so ingrained, and so can people just take more? Yes. But I think we're so ingrained in, there are companies that make chips or cookies or whatever, and they have those little 100-calorie packs because you can go out and you can buy a whole sleeve of cookies. What happens when you open a whole sleeve of cookies? Like, has anybody ever bought Girl Scout cookies? Like,
I'm just thinking though that your one gummy could have the 0.4 milligrams, whereas if you had 20 gummies in a package, that would have to be dispersed throughout that package.
So it's per package. So you can still have a dozen gummies in a package. It's just in the entire package, you couldn't exceed 0.4, whereas before 0.4, you could have 0.4 in every single gummy. So it's standardizing the dose.
Full 0.4 in one gummy and package it, is what I'm saying.
You could.
They're still going to say that has some impact, right?
Yeah.
I really feel it if I do that one.
Certainly.
And I appreciate it's only one. Maybe they start creating little shot things that you can buy because those are going to have the 0.4 in it. And you can slam them and be on your way.
I hear you. I can't disagree. Yeah. I mean, the thing about it is we have these policy proposals don't just have input from public health professionals. These policy proposals have input from the cannabis lobby, which, by the way, is huge. And you want to know who owns most of the cannabis industry in the United States? Big Tobacco. Because guess what? They're not selling their product anymore. But what's the emerging product? Cannabis. And so we're seeing the cannabis market roll out just like Big Tobacco rolled out in the 80s and 90s. It is which I don't think anyone can say that the Big Tobacco Corporation did not do a good job marketing their product, because they did.
We have a question in the chat. Would you say this is a packaging issue or a product issue?
Would I say this is a packaging issue or a product issue? I would say this is a product issue and a demand issue. Because if people are not demanding the product, there's not going to need to be a supply. So there's two things at play here. One, it's the actual product itself. And then two, people want that product. And so we've got the access issue that we need to address. But then we also have the issue that we have people who are using cannabis products for lots of different reasons. They're using it to self-medicate physical pain or emotional pain. They have an underlying mental health condition that either they know about or they don't know about, that they're trying to feel better. We've got people who feel isolated or neglected, or they're stressed because it's heavy exam season, there are so many reasons. And so we have to not only address the issue of supply and the actual product, and the packaging is part of that, but we also have to address the demand, because they always, it is very basic economics. It's always about supply and demand. So I think it's a combination of all three of those things. So there's also, now the federal government is moving to eliminate the Delta 8 market entirely. And so there's prohibited synthesis. So any cannabinoid that's synthesized or manufactured outside the plant, like Delta 8, and outside the plant, meaning the actual cannabis sativa plant, anything that is made, created, or derived by CBD is excluded from the definition of hemp. And then what I was talking about, synthetics, anything that's pharmacologically similar is also going to, if this lasts through November, would also be banned under this rule. And also the Secretary of Health and Human Services would be authorized to identify and ban any other cannabinoids that have similar effects to THC if they're not explicitly addressed under this law. And so that would put the authority with the Secretary. I mentioned the preemption, so I'm going to just kind of gloss over this slide just to say that preemption is an issue, but there's this looming legal battle because the federal rules interact with state rules. And we have federal rules that are not supposed to be overstepped, that are being overstepped by a majority of states in our country. And so there is a conflict with interstate commerce. And what the law would do was, even if Tennessee continues to allow certain concentrations, the federal change would ban anyone from those products crossing state lines. That already exists in some capacity. For example, you cannot use the U.S. Postal Service to ship cannabis products that are not legal in certain areas. So we could purchase something here in Knoxville and they could mail it to us, but I can't purchase something from Colorado and have it shipped to me here. That would be illegal. Let's talk about the TABC era of regulatory transition and licensing and how things are shifting over to TABC from the Department of Agriculture. And so TABC, under the law that was passed last year, actually it might have been 2025, now license suppliers, wholesalers, and retailers. So we start all the way up the chain from the supplier down to the wholesaler, all the way down to the storefront retailer. This is part of the new, it's right there on the slide. So 2025, I said it, but there it is. This was adopted in September 2025. It did not go into effect until 2026. And the goal is to move this fast growing. I mean, it was so rapid. Once people said Delta 8 suddenly was in every gas station in the state. And so the goal is to take this completely unregulated hemp market in Tennessee to regulate it into a consumer product industry. The framework helps to protect consumers from mislabeled products, kind of like we were discussing before, to ensure that there are consistent quality control and safety standards. There are a lot of heavy metals and chemicals when the THC is synthesized out of the plant. And so to make sure that there are no residual heavy metals in these products is part of this new rule, and to have accountability across that supply chain so that if everybody all the way up the chain is responsible. If a retailer sells something that's mislabeled or misguided, then they're responsible, but so is the supplier and so is the wholesaler. So it runs the gamut. In March of this year, TABC, so the law goes into effect January 1st, 2026. By last month, TABC had uncovered more than 650 illegal hemp-derived cannabinoid product retailers across our state. So there's a lot of regulation, and I would arguably say not enough ABC agents to do what they need to do to get out there. I mean, 650, that is a lot more retailers than they expected to have to check on.
What consequences?
The consequences are, I would say, as if you compare it to alcohol, for example, are more severe. So I would say that the General Assembly put in some pretty strong consequences. If someone is caught with a mislabeled product, selling to a minor, etc., there are strong consequences, and there is a tiered system to where if you continue to be non-compliant, you will lose your license. And they're beginning to control the number of licenses. There are conversations about controlling the number of licenses in the state, although that hasn't happened yet.
And do you think that this will be effective in controlling the situation, or will it go backdoor where, like, moonshine?
Yeah, that's a good question. The question is, do you think that the regulations and the compliance will help to control the emergence of all of these products and proper compliance? And I would say that the problem is already way out of control. So I think it's going to take us years to catch up from that. And the only way that we will catch up from that is if TABC, which historically they are very diligent in their regular compliance checks and their fines and issuing those fines and revoking licenses when appropriate. I think it's going to take years to climb out of that hole, but I do think that there will become a black market or an underground market for the product if they are pulled. However, if there's an underground market, it's easier to regulate because it's not easier to regulate. It's easier to cut it off when you find one because it is clearly illegal. And so right now we're in this gray area of, well, it's is it legal or is it not? But what's actually in the package, and then it has to go to the lab to be tested. TBI's lab, Tennessee Bureau of Investigation's lab, is so backed up, they can't even test these products because there's so many that are mislabeled. And so it's gonna, I don't know what the answer is, because the fiscal note on that at the General Assembly would never pass. And we can't afford to do that, in my opinion. So go ahead.
One, Sven once made a great comment about THC and THC. It's like putting toothpaste back in the tube. Is kind of where we're at right now. Two, does the TABC evaluate gas stations? Because they don't currently under liquor laws, and most gas stations do sell these THC products. So are they also catching gas stations, or are we just going for actual like smoke shop, head shops right now?
Yeah, so they oversee all cannabis compliance now, which extends. So they were able to hire a number of new agents to be, because the number of places where they have to check is now exponentially more than it was before. And so yes, they have more agents to do that. And the other comment that was made is that Savannah Mead from ASAP has said that the situation we find ourselves in now is like putting toothpaste back into a tube. And yeah, that's my sentiments exactly. So to recap, when we talk about the product and the regulations on what can or cannot be in the product, per Tennessee state laws, the high density cannabidiol products may not contain concentrations of total THC that exceed 0.3% on a dry weight basis. Additional testing is required to determine whether these products contain compliant concentrations of heavy metals, as I mentioned before, pesticides, residual solvents, microbials, and other harmful chemicals that are required by the statute. So the bill actually had these levels in it. If you're just really interested, you can go look up the bill, which I've got on the last resource slide, and you can look to see what those doses are as to what's acceptable or not. The products have to have a certificate of analysis. And so to be legally sold in the state of Tennessee, they have to have that COA, and it has to have a full panel testing that includes potency, heavy metals, pesticides, and residual solvents. These have to be linked. The certificate of analysis has to be linked to a QR code, a quick release code that is directly on the package that links to the lab results. And you have to be able to have a track through that QR code on the certificate of analysis from the manufacturer all the way to the consumer. So the consumer has to be able to, if you noticed, you may not have tuned into this, but with the pictures I showed, when you saw the back of some of the packages, it did have the QR code on there. So the consumer can scan. If they choose to Jolen's point earlier, they could scan theoretically the QR code that would take them to the certificate of analysis where they could see what is actually in that product. So when TABC goes out and does their compliance checks, that's one of the things they're looking for. They're scanning those QR codes on all of the products to make sure that the certificate of analysis lines up. And then sometimes they're testing those products to make sure that what the product claims to be in the package is what's actually in the package. Years ago, there was an analysis done on these products to see what the variations were in what the package said was containing therein versus what was actually inside. I think, if I remember correctly, it was like 93% variability. So this is supposed to clear up some of that. The certificate of analysis also has to be processed by one of the accredited labs that is within the Tennessee statute. So how does this trickle down to retail and operations? Well, first of all, there's a strict 21 and over rule for all hemp-derived cannabinoid products. There are some prohibitions on kid-friendly packaging and shapes, like can't look like a gummy bear, or one of the big products was Scooby Snacks. It cannot have a cartoon character on it that a kid can associate with. And then there are some requirements for child-resistant packaging to make sure that a kid doesn't see a package of gummies and think, ooh, yummy, I'm going to have some of those because it looks like the fruit chews that they get for snack at school, and also specific warning labels. There are also location restrictions And so the 2026 ban on vending machines also bans home delivery and certain online to consumer sales models. And then there are rules for on-premise consumption. So there are a number of bars and in some cases restaurants in Knoxville and all across the state that now have to have a TABC license to be able to sell the cannabinoid products for on-site use. So a bar, one of the examples of how you would do this is you've got a bar and they have CBD that they make a tincture and then they would put CBD in your drink. So they would then have to have, even if it was a brewery, for example, there's some breweries in Knoxville that have some cannabis drinks. So in addition to having a beer license to sell and brew beer, now they have to have a TABC license as well, which historically beer in Tennessee is regulated at the local level, whereas wine and spirits are regulated at the state level, and compliance follows suit. In addition to having a beer license locally, the breweries now also have to have a TABC license to sell the cannabis drinks. There is also now a tax. So I mentioned this in the marijuana timeline. There's a 6% privilege tax in addition to the sales tax on top of the standard local tax. The levels are 2 cents per milligram that tax the cannabinoids, and then $50 per ounce that taxes the hemp flower plants. So those are the tax levels. Retailers are also required to track and remit the taxes to the Department of Revenue. This is supposed to help monitor the underground market, just to make sure that it's actually being sold and enforced legally. So when it comes to compliance checks that TABC is conducting, again, they're checking the QR code functionality. They also are going to be checking the age verification logs. So when there's a sale, it goes into the log, and TABC are checking these things. They also, when it comes to advertising, the suppliers, the wholesalers, and the retailers must avoid therapeutic or medical claims. And this is a Tennessee law, by the way. And then when we think about liability, there is a shift from small fines to potential criminal charges for non-compliant concentrations. And so that's where we've got the teeth in the rules to make sure that the manufacturers especially are being compliant with the laws that have been set forth. And then I mentioned this, but just to reiterate, the regulations that with the shift from agriculture to TABC went into effect January 1st of this year. So the penalties, this was a question before. Violations can result in automatic license cancellation that is harsher than the prior law. And then this is intended to defer unsafe practices as selling contaminated products or products that are mislabeled with respect to their potency, and then especially selling to minors. So hopefully that's a little bit more clear than mud. I know it's really convoluted, and if you read the statute, it's long, but the statute really helps to, if you can work your way through it, it does help to make the regulations much more clear as it pertains to the Tennessee law. The Farm Bill, a little bit less clear because it just legalized everything. But the Cooper Amendment that was enacted in November of last year is a little bit more clear because now we know more about these products. Congress is hoping to kind of consolidate and regulate those, and in some cases ban some of those products. And so we'll have to see in the fall what happens with that, because that's really going to change the landscape of where we are. So that's all I have for you all today, but I'd be happy to have a conversation and field any questions that anybody has.
Anyone at this time have any questions?
Yeah, Jolynn.
Anybody else?
We have some.
Yeah, we have time, so go ahead.
I continue to be very ambivalent about what I think should happen. Would you give a review of your perception of what is appropriate, including questions like prohibition didn't work, so what's the lesson there for regulation? in this area? And what is the effectiveness of medical marijuana? And what are the implications of that for recreational use? All of those questions about what should be done in the best interest of society and individuals.
Great question. So to summarize, and correct me if I'm wrong, the question is, what would I do or what would I suggest to regulate cannabis? Because prohibition did not work for alcohol. There's obviously demand for the product. And where's that happy medium? Is that a fair way?
What's the empirical basis?
And what's the empirical basis of that decision? So that's a great question. And as a researcher and a scientist, I'm always going to err on the side of data. And who's collecting data on this issue? That's going to be the FDA. So if the FDA comes forward and says, yes, there is medical application for this, I'm going to listen. Right now, where we are, now the FDA has approved some cannabis-derived substances. The first was Marinol. Marinol is a prescription medication. Physicians can prescribe it because it can be dosed appropriately. You know, if I have a 9-year-old, and obviously she's smaller than I am, so she's about this tall. If we were to come down with the same bacterial infection and required an antibiotic, I'm going to need a stronger dose than would she, because I'm more than twice her size. With marijuana, we don't have the ability to do that or dose it because what's the potency of THC? How is someone ingesting the product? There are lots of unknowns, lots of questions about that. Also, when it comes, I'm sorry.
So we need more research.
Well, there's research ongoing, and there has been research ongoing for decades. In addition to Marinol, the first cannabis-derived product is Epidiolex. Epidiolex is also FDA approved for medical use. It can be dosed. And so one of the things that it's used for is nausea in, I'm losing, yes, that wasting disease. So there are a number of illnesses that initiate wasting disease. And so it's often used to treat wasting disease. It can also be used to help people who have a low appetite but need nutrition to eat. So there are lots of uses for these medications, but they're FDA approved because they've gone through the rigorous scientific studies that the FDA does, and the FDA has outweighed the benefit to the risk. So with marijuana, the FDA continues to research it, and they continue to put out reports that say the benefit does not outweigh the risk. And so if and when that changes, I'll be all ears. And I think there are a number of things to consider. One is, how is the product used? Because smoked cannabis is never going to outweigh the risk when it comes to medicinal benefits. We've been fighting smoking and secondhand smoke for decades now. And now we have a new product that suddenly people who would never pick up a cigarette are smoking cannabis. And so that is an issue at hand. We have to be careful about packaging because overdose of young children. There are so many instances of children overdosing because they have ingested the product that an adult had laying around. So those tamper-resistant packages are going to be important. The child-resistant packages are important. It, to me, always falls back on the research and the data. And I hear people say, we need to research it. It's being researched. And to me, it's the FDA. And the FDA, it's the FDA's final decision. And so one of the bills that's in the Tennessee General Assembly right now is following that, but Tennessee's stance is a little bit different. I do think we'll see a different atmosphere in the General Assembly next year as opposed to what we're seeing this year. But what's happening right now is a bill has passed that says, regardless of what the FDA decides or the federal government decides, Tennessee reserves the right to make our own decision, but the General Assembly has to make that decision. And they have taken the decision away from the commissioner of the Division of Mental Health and Substance Use Services. So I don't know that we're going to have that same atmosphere in the General Assembly next year, but time will tell. We'll have to see. Good question.
Any other in-person questions before we move to our virtual questions? Right. I'll stand up here so that our folks online can hear. We have a few questions that were collected during registration. Thank you for sharing those. So the first question is prevention being taught to students in grade schools given the rise in popularity of vape pens and other modes of partaking of THC?
Great question. Two answers to that. First, and I'm going to pop forward to this slide. With the Prevention Alliance of Tennessee, we're kind of the umbrella of coalitions all across our state. Of the 95 counties, we have existing substance use prevention coalitions in close to 70 of our 95 counties. In most of those counties, there is direct education on behalf of the coalition being given to grade school and secondary school aged children. It's not necessarily universal. However, there's a bill in the General Assembly this year that would mandate substance use prevention education for all grade schoolers in the state. And so we'll see how that shakes out. It is progressing in the General Assembly, but to my knowledge, as of today, has not been given a final vote in the House and the Senate.
Thank you. Another question is, and you talked to a couple of these, what other gray areas in Tennessee law are there where enforcement or interpretation has been inconsistent?
Gray areas in laws. There are some communities. So if we go outside of THC and CBD with respect to alcohol, there are some communities, because beer is overseen locally and regulated locally. There are some communities where the beer outlet does not lose their beer permit if they fail a TABC liquor or spirits compliance check. So there are a lot of communities that have closed that loophole, that the beer board convenes and says if an entity, if a retailer loses their TABC permit, they automatically lose their beer permit. So that's a loophole, example of a loophole for alcohol. For tobacco, the loophole is there's no retail license, and so we have no list of how many tobacco retailers there are in the state. When it comes to CBD and THC, I think we've talked about that extensively today. The biggest loopholes are the variation in federal law and state law and how those differ and how we're not supposed to go over and beyond the federal law, but states are anyway. And that's a pretty huge loophole, and creates and so why does this matter? It matters because of perceived risk, perception of harm, perception of access, because we're in passing these laws, we are changing the scope of what adolescents think about substance use. And so I have very different feelings on a mature adult using cannabis or THC than I do someone under 24 with an underdeveloped brain, because the ramifications of how that substance affects the brain development, the myelinization of brain pathways and the synapses, the synapse pruning, the gray matter and the differentiation of gray matter and white matter, and how the emotional connection in the prefrontal cortex is created during those important years of brain development. You add cannabis in any dose in that, and it changes the physiological structure. So I think it's really important that we stay on top of this issue, because I think about all these kids and the epigenetic effects of cannabis and how those draw down generations is so critical. We know now that it's not just the female. We know not to smoke or drink alcohol during pregnancy, but we just finished a campaign to make sure women know that any cannabis use during pregnancy is equally as dangerous. But it's not just the woman, it's the male as well, preconception, because we know that there are epigenetic effects. Epigenetic mean that my genetics, that the cannabis changes my genetics that can be passed on to my offspring. And so we're seeing those epigenetic effects and the data from those being really important. And so men need to know that cannabis use preconception is going to affect the genetics of the sperm that ultimately fertilizes an egg. And obviously cannabis use for women as well change the nature of that egg. And so then you have these genetic changes that ultimately affect the brain the most, are going to affect mood, behavior regulation, motivation, reward in that area, that prefrontal cortex area of the brain. And so lots of implications for this as we move forward in the public health space.
Thank you. All right, 2 more questions for you. Have there been any recent enforcement actions or shifts in priorities from agencies like TBI that we should be aware of?
With respect to TBI specifically, I don't see any shifts. They are just inundated with products to test. And so there's just a long line of testing. And it has to do with money because there's so many products to be tested, and the amount of money that it costs is astronomical based on that. And so they have to be selective with what they're going to examine. With respect of the shift from regulation of cannabis going from Department of Agriculture to the Tennessee Alcoholic Beverage Commission, I think we see a huge change in the shift between those 2 agencies. Obviously, there's a lot taken off of Department of Agriculture, but there's a lot put on TABC. And so TABC, I think, has a great infrastructure to be able to oversee this because it's so much, it's so similar to the way we regulate alcohol in our state. And so I think they're well positioned. As I've talked to representatives at TABC, they're poised and ready. I think they're committed. I mean, just in the first 3 months of the law going into effect, they've found over 600 businesses that are selling products they shouldn't be selling. So I think there's evidence of commitment there. And I think as we move forward, they'll be even better positioned to regulate the products in our state. Obviously, we also have to think about how the Farm Bill comes into that as well, because if there's a Farm Bill change in November, I'm going to optimistically say when there's a Farm Bill change in November, there's going to be, I think, there's going to be a huge wave of non-compliance issues that TABC is going to have to oversee.
Thank you. And then the last question we collected during registration is, if I'm not a professional in the field, what kind of role can I play to help people understand how these policies work? I worry that if I talk about policy, it'll just make some people bored.
Well, thank you. That's exactly how I have felt today and wondered the same thing. And I think ultimately what it comes down to is we've got to figure out what's your why? Why do you care about this issue? And if you're talking to somebody, why would they care about this issue? If they're a parent, they need to know about cannabis products and how they will affect their child. And so I think understanding the significant impact that cannabis has on brain development is imperative for parents to know. So that's a great way to connect. If it's a retailer doesn't want to go to jail for selling a product that is non-compliant with Tennessee laws. And so I think the impetus for them is I want to make sure that the products that I have on my shelf are compliant. And so if I were a store owner, I'd want to be scanning those QR codes and I'd want to make sure the certificate of analysis is there. Because if I could bear criminal responsibility, I'm going to double check my bases and make sure. And so I think regardless of the sector, I think about who that sector is and what is it that they care about. And then how does what they care about tie to the laws related to cannabis and THC in our state? And then I would come up with their why. Because remember when I first started in prevention in Knox County, I was tasked with creating what we called a community stats book at that time. And it was like a 75-page book on statistics related to substance use in Knox County. And I mean, I don't know why we produced that thinking people were going to flip through all 75 pages and read that. We do not do that anymore. Today, okay, let me also state that was 22 years ago. So period. But now we've got to have an infographic that somebody can digest in 13 seconds or less. And the why has to be directly apparent to what they care about. So they don't need to know all the information. They just need to know the information that pertains to them. And so figure out their why, then you'll know exactly what they need to know and probably what they want to know, what's relevant to them, and then just give them that dose of information.
Great, thank you. Any final questions? Yes, Jolene?
I have another question sort of related to that, which is how do you respond to common opinions, arguments such as, well, pot is not as dangerous as alcohol and that's legal, so we should make marijuana legal also, or we shouldn't make it legal because it's really just a gateway drug, and so that's the biggest problem associated with it. And I'm sure you hear lots of others.
Yeah. So question is, how do you defend someone who is saying, well, pot's not as harmful as alcohol, or on the flip side, it's just a gateway drug? And so I'll start with your first question. Pot's not as harmful. People will say pot's not as harmful as alcohol. And again, I'm a data analyst. I'm going to go straight to the data, and I'm going to show that prevalence of use across the country is, so alcohol prevalence of use used to be the highest of the substances, and cannabis was among the lowest. Now we've seen a flip-flop where in most communities it's almost level, and in some cases cannabis has tipped the scale, marijuana has tipped the scale as the number one most commonly used substance.
Alcohol is below drugs.
In some instances, alcohol is below in prevalence of use some other substances. And so again, I fall back on the data every time, because when I believe that people, and I just had this conversation in Vienna, Austria with my colleagues from across the globe, because we're all having the same conversation. How do we shift from the attitudes of the 70s, which is what you're talking about? Pot is not as harmful as alcohol. And I think potentially we could say that's arguable, especially with all the research that's come out about the link between alcohol use and cancer. But I think what people have in their mind is the pot of the 70s, the pot of the 80s. And that is not what we're dealing with now. We're dealing with a much higher potency drug that has a direct impact on the brain and on genetics. And that's what I talk about. I talk about the significant linkage between cannabis use and schizophrenia, and cannabis use and other mental health conditions. And, depending on who I'm talking to, talk to a law enforcement person. Well, how do you conduct a field sobriety test for cannabis use? There's not one. So you could try the alcohol one, but it's not going to be, it's going to be indefinitive. And so the field sobriety test is really important. You could do a blood test. That's probably about the only way you're going to know if somebody's actually under the influence, but also that test is going to be hours after the fact of an incident. And furthermore, it's going to depend, like however long cannabis has been in their bloodstream is going to be dependent on how cannabis naive or not a person is. And so there are so many factors that come into play. So again, I'm referring to the data. So I'm brushed up on it because it's my job. But if it's something that you commonly hear, I would just do a little bit of research from a reputable source. I'm not talking about High Times. I'm talking about from an actual reputable source where it's not pro cannabis. It's not necessarily just saying ban cannabis, prohibit cannabis. I think we can find some non-biased studies in the middle to be able to see some of those implications.
Not sponsored by the companies.
Yeah, correct. Yeah, not sponsored by the industry. I think that's important. The second part of your question was, remind me, please. Gateway drug. Anytime I hear that, I think no, because whatever substance somebody uses first is their gateway. And I would argue that most of the time it's probably not cannabis. I would say most generally speaking, it's most of the time it's probably today going to be vaping. And so we'll start with vaping, and then we'll kind of move across. And then if somebody moves off from a substance, then they're likely to be a multi-substance user. So people either tend to be sometimes a single substance user, or they're going to be a polysubstance user. They're going to just be using a lot of things. And that's especially indicative of when we have someone on the trajectory of substance use disorder. They're going to be those polysubstance users. But for people who are using a substance to self-medicate loneliness or isolation or stress or anxiety or whatever it is, it's going to be whatever they can get their hands on first. And so that's why I've always been a proponent of limiting access, because if we can limit access, if a kid cannot get cannabis, they cannot use cannabis. But if we just broadly legalize cannabis, then it's going to be everywhere, just like alcohol. That's why kids' first on-ramp for so many years was alcohol, is because it was so prevalent and it was everywhere. And at the end of the day, for me, this is about protecting kids and children and youth and families.
Please join me in thanking Stephanie for her time. Thank you, Stephanie. Over to here. All right. So thank you again, everyone, for joining us this afternoon. Thank you to those of you who joined us via Zoom, and also those of you who came out here in person. We know it was a warm day and glad we helped you get your steps in. Now, before we conclude, I do want to do a final reminder. If you can, please take a few minutes to let us know what you thought about today's presentation. Your responses do actively help shape the future sessions of this series. And so we really do appreciate you taking the time to give us your thoughts. Now, on behalf of All for Knox, I want to say thank you again for joining us today for today's session of the Substance Misuse Prevention and Education Speaker Series. This does conclude our webinar, and we appreciate you so much for your participation, and we look forward to seeing you again in our third quarter presentation. So stay tuned for the date, time, and further details. Take care, everyone.